Jean-Pierre Ngagari works at the National Laboratory and was among the first technicians to start testing samples of COVID-19 since the onset of the virus in the country. He says at that time they thought it wouldn't take this long.
The first day was surprising to everyone, but the good heart and the big heart that is really from our professional and the guidance we are getting from our leadership. That is the only foundation from that day where each and one was surprising, helped us to sit, sustain and do our daily work for COVID management.
Residents say it's important for one to know their status in regards to COVID-19, hence why they go for testing. It helps us to know our status to protect ourselves and those around us across all sections. The country also ensures that we are aware of everything and how we should behave.
It's good, I guess, to know your status. At least you can travel. You know you're not transmitting the disease to anyone, which is good as well. Well organized. The chairs are comfortable.
According to the Rwanda Biomedical Centre, the number of laboratories able to test for COVID-19 currently have risen to 12 from just 1 in 2020, when Rwanda had just registered the first case of COVID-19. In addition, 45 hospitals and clinics and more than 500 health centres have the capacity to test for COVID-19 using the rapid antigen test. Officials from the National Laboratory say that the number of tests conducted daily have risen significantly, which is a great step towards the fight of the pandemic.
The capacity is there. We have all that is required, as in terms of human resources, but also as in terms of other resources like the materials that are required for us to be able to test, be it for RT, PCR testing, or rapid diagnostic testing. So we have all the materials and we are able to conduct mass screening in hotspots, plus other categories other categories within the Rwandan population.
Currently, among the tests conducted in Rwanda, 70% are via the rapid antigen tests, with the PCR tests accounting for 30%. Dr. Gatare Swaib emphasized that the rapid antigen test is very effective and is used across the world.
Today in Rwanda, we have two methods of testing for COVID-19. The first one is the one that goes for to test for the virus itself, which is called real-time PCR. And the second one is the rapid diagnostic test. And with the rapid diagnostic test, WHO recommends that before an RDT is utilized, it should have a sensitivity of at least 82% and a specificity of at least 97%.
The Rwanda Biomedical Centre says it's looking for ways that the price of the antigen test can be reduced to make it easier for many people to test for COVID-19. RBC says that of the 12 laboratories with the capacity to test for COVID-19 is one at the Kigali International Airport, making Rwanda the second country after Germany to have a COVID-19 testing laboratory at the airport and the first African country. Results from this lab take between 5 to 8 hours as opposed to before when it would take 36 to 72 hours.